So yes, absolutely. Testosterone is a natural hormone in your body, but taking testosterone from outside sources is not natural. Let's talk about what are some of the risks of taking testosterone replacement therapy. Hey guys, so Dr. Segal here. So the question is, I don't understand. Testosterone is just a natural hormone. How can taking it be bad for me? Explain this. So we get this question a lot. I think there's a ton of misinformation about testosterone out there. And at the end, so we'll go through the risks, and at the end, I'll talk to you about usually the parting shot, the statement that I tell the guys to help them decide whether the risks are worth it or not. So stay tuned for that for sure. So let's go through them one at a time in no particular order. So testosterone can make prostate cancer grow and breast cancer grow. Doesn't necessarily cause these things, but it can cause them to grow. Now, guys that have had prostate cancer treated, their PSA is undetectable. In certain circumstances, we will put them on testosterone therapy, to be clear. The way, and if you check out our testosterone video on weight loss, it kind of explains this concept, but testosterone can get converted to estrogen in your body, and that estrogen can stimulate breast cancer growth. So if you have any of these cancers, shouldn't be on testosterone in general, I should say that. Lower urinary tract symptoms. So if you have really bad urinating problems, all right, so you've been diagnosed with an enlarged prostate associated with symptoms, testosterone can make your prostate get even bigger, okay, and can make those symptoms worse. But here's the caveat. If you're on medication to help with your lower urinary tract symptoms, and you say, Doc, it's all controlled, then you could certainly be a candidate for testosterone replacement therapy for sure. I want you to know that. So something called, this is a big word, erythrocytosis, or too many red blood cells, okay? This is also called polycythemia. What happens is testosterone can sometimes increase your blood counts even more, all right? And that puts you at a higher clotting risk if your blood is more viscous. It's thicker because of the increased red blood cell concentration in it. Now, the caveat, right, is if you are seeing a hematologist and they have this under control, they have you on medication or other therapies to fix this problem, then you could be a candidate for testosterone replacement therapy for sure. Sleep apnea. And the quick caveat here is that if you have that treated with a CPAP machine, oftentimes guys do fine on testosterone replacement therapy. Uncontrolled heart failure. Okay, you shouldn't be on testosterone replacement therapy, but we've plugged guys in with cardiologists, gotten that under control, and then they're a candidate for it. Okay. Cardiovascular risks are extremely controversial, and meaning that the risk of cardiovascular events with testosterone replacement therapy that's an extremely controversial topic. There have been studies that have shown low testosterone in and of itself, okay, can put you at a higher cardiovascular risk. So then the logical thing is, well, then let's just give some testosterone. But then there's been studies that have shown that exogenous, meaning supplemental testosterone, can put you at a higher cardiovascular risk. The way I usually handle this is if somebody has an already higher cardiovascular risk, I plug them with a cardiologist, which they probably already have, or at least consult with them to see if they'd be safe for testosterone replacement therapy, and we check their lipids, okay? So that is a trickier topic, but that's usually the way we handle it in that situation. Blood clotting risk. So it can increase your risk of blood clots. The caveat, or the way that we handle this, is oftentimes we screen people to see if they have a family history of any clotting disorder or blood clots, or certainly a personal history of this. It's important, because testosterone can alter other parameters in your blood work, that the following get checked. And we do this with all our patients, and I want to just make sure that somebody should be checking these for whoever's on testosterone replacement therapy, so that you guys know this, either your urologist, PCP, endocrinologist, whoever's giving you the T therapy. CBCs, your blood counts, your lipids, your liver function tests, okay, your PSA for sure, and your free and total testosterone. Testosterone values also change over time. And so it's important to check the testosterone. We usually check it a couple times a year to see if the dose needs to be tweaked. And we have another video about kind of how your testosterone levels change in everybody as you get older. And so brings me to kind of my pearl of wisdom, all right? Now, I told you a bunch of risks with testosterone replacement therapy, but what I also wanted to try to illustrate to you is that if these risks can get mitigated or fixed or treated, you can be a candidate for testosterone replacement therapy. So unless your doctor says absolutely not, if they tell you the risks, I don't want you necessarily to be spooked by it. Only you can kind of make that ultimate decision as to whether it's worth it for you or not. I've seen guys turn their whole life around on it because they just feel so much better, okay? It can improve your sexual function. It can improve your muscle mass, your strength, your bone density, okay? Some people have said that it can even improve your cognition, all right? The way that you think. So there's a lot of good things about it, don't get me wrong, all right? I just think you need to have a rational conversation with your prescribing doctor in regard to the risk-benefit analysis, okay? So hopefully, guys, that gives you some insight as to some of the risks of testosterone replacement therapy, and to also let you know that a lot of these risks can be decreased or mitigated. And ultimately, it's really kind of unless your doctor says you absolutely can't get it done, it's your decision. So hopefully that's helpful to you. Thank you so much for listening. We certainly appreciate it. We release at least 2 new videos a week, and please subscribe. Thank you.